I now have the pleasure of introducing us to Cari Egan. Dr. Cari Egan is the Strategy Development and Innovation Lead for Communicable Disease Control in Alberta Health Services. Her interests in sexuality and sexual health started with her first paper in nursing school and has taken her to Sydney, Australia, where she coordinated HIV clinical trials and completed her PhD exploring the sexual behaviors of international young backpacking populations. In response to her research in Australia, a sexual health promotion campaign for young travelers was developed that has been running for over a decade. Cari's current focus is on developing a provincial sexually transmitted and blood-borne infection strategy for Alberta in an effort to have sustainable impact on the escalating rates and outbreak conditions for STBBIs. Please welcome Cari Egan.
Well, thanks for having me. It's a pleasure being here, and it's nice to see some familiar faces in the audience. I'm going to be just talking about a project that we've had underway for the last 18 months or so, and it's been an exciting opportunity. I'll give you just a little bit of history just to set the context. So back in 2009, there was a syphilis outbreak declared in Alberta. And so Alberta Health created what was called a sexually transmitted infection and blood-borne pathogen strategy. And they put a lot of work into developing that strategy. But unfortunately, in April of 2016, another outbreak of syphilis and an additional outbreak of gonorrhea was declared. And so the rates have only escalated and, in fact, have continued to escalate, which I'll talk to you about today since then. I'll just get started. I wanted to just set the context for a current snapshot of what the STIs and HIV look like in Alberta. So, why did we need a strategy in Alberta? So, just to give you an idea, in April of 2016, Alberta Health Services, which is kind of the equivalent of a regional health authority, only we do it for the entire province in Alberta. And so we took on a coordination role of doing a new strategy. But we decided to do it differently in hopes of having a different impact. So, just to recap some of the STIs, chlamydia, as many of you I'm sure know, usually primarily affects young populations between the ages of 15 to 24. However, the rates have risen dramatically since 2000, and they're currently 2 times higher than they were in 2000. If we look at gonorrhea, the rates have doubled since 2014, and they just continue to rise, and I'll show you a new snapshot for this year. But nearly a third of the cases report same-sex partners for gonorrhea. So these are statistics from this year, which are actually not publicly available, but you can see, I wanted to share them with you because you can see that the last 3 bars are referring to July, August, and September. So clearly we have the highest rates in the history of gonorrhea since the outbreak was declared in April. And if we continue on this path, we'll have over 4,500 cases in this year alone. So if we move on to syphilis, Alberta, not unlike any other province in Canada, it primarily affects most people that are infected with syphilis are men. 90% of the infection cases in Alberta are amongst men, and that's 7 times higher than amongst female populations. And similar to gonorrhea, the rates of syphilis since 2014 have gone 2.5 times higher, and so that surpassed the outbreak conditions of 2009 when the first outbreak was declared. So nearly 3/4 of the male cases do report same-sex partners, and 1/3 of the cases that were diagnosed were co-infected with HIV. And as you likely know, there's of course significantly more of a risk of acquiring HIV when you're co-infected with an STI. So for HIV, there was a slight dip in 2015, which has corrected itself in 2016 with 280 new cases in 2016, and 44% of those cases are amongst men who report same-sex partners in Alberta. And so that being said, that's what kind of prompted us to try and think differently and do something a bit differently. And so we took a very When I took on this role of coordinating this, we really wanted to try and determine what could we do that actually would have a significant impact. And really, when you think about it, there's so many great services available in many of these different provinces. And yes, there's significant inequity, as we've heard, depending on where you live in the province. And your geographical distance from urban centers. But we did recognize that there had to be more of an impact if we were able to collaborate with others across the province. And so that's what we did. I started out this process by doing 44 qualitative interviews with stakeholders across the province to understand the current gaps and challenges. Then we did a few meetings, gathering more stakeholders, did more snowballing, and now we're sitting at over 400 stakeholders in the province participating in this work, representing 150 different organizations. And so that includes, the NGOs, the community-based organizations, the Alberta government, First Nation Inuit Health Branch, every single First Nation community, every single Métis settlement, the Métis Nation of Alberta, individuals with lived experience of HIV and viral hepatitis, and of course also we really wanted to be inclusive of those upstream considerations of poverty, homelessness, and mental health and addictions as we tried to develop the strategies to have an impact on these rates. So what we found was, as a significant theme of the discussions, and some of the people in the audience were actually part of this work, so that's great to have them a part of this presentation. Like I said, there's so much incredible work that happens in these provinces, but one thing that became clear as people started meeting was people didn't know about it. And so it really has limited impact if we can't actually leverage our own work and help others or expand it. And so the way it looked was there was a lot of urgent, but there's a lot of complexity to being able to address this challenge in the province. So there were 5 different groups that were created, 5 different focuses, one in prevention, one in screening, optimizing access to testing. Also a third group in the area of treatment, regardless of where you lived in the province, being able to optimize access to treatment, which in Alberta there's a centralized model, so you have to drive to Calgary or Edmonton if you're living with HIV or hepatitis for access to a specialist. We have a lot of work to do compared to British Columbia in an effort to increase access to care, because I know BC has more of a decentralized model. And then there's a 4th group that focused on support services for those living with HIV and hepatitis, and then a 5th group, which was a new group that was created. This area was not a focus of the first strategy created in 2009, but it was a group focused on stigma, and in fact, Brian Hansen led that work, and he's the next presenter. So these 5 different teams, there are multidisciplinary representatives from across the province, and including those with lived experience, and they created 74 recommendations that they identified as the significant priorities that Alberta needed to focus on in order to create a strong foundation for ongoing work. So the foundational pieces that they identified in these recommendations was to, first of all, get a good snapshot of really what is the current state. And so the asset mapping is in the areas of figuring out who's providing STBBI screening, what do they provide. There's a lot of differences between one clinic to the other, extragenital testing, including rectal and throat swabs. It's not standard operating procedure in most clinics. Also doing a really good exploration of how much technology do we actually use and how are we applying it, and are we optimizing the utilization of telehealth in the province. New immigrants was a very significant focus for this work, and also doing an LGBTQ service mapping exercise. And there's a lot of interest in Alberta at the moment in this, and there's quite a number of people that are wanting to do this, so it's quite exciting. Corrections, there was a lot of inequity identified in safe release discharge planning in Alberta. So the correctional facilities are really interested in working with those service organizations that actually support these populations to increase access to care. And then the final area was to do an asset mapping for support and counseling. Another recommendation was to continue. The stakeholders identified, the ones that participated in those development of those recommendations, said this is a really great platform. It gives us an opportunity to continue to communicate with each other, have cross-sectoral communication, including with government, so that you can really make sure that your messages are actually going to the groups that have some influence over policy development and resource mobilization. And so the different working groups that they propose being developed based on the number of recommendations, I did an analysis of the recommendations, and these were the key themes that came out. So in the areas of PEP and PrEP, primary care, STI and HIV and viral hepatitis, corrections, pharmacy, Indigenous populations, and research and evaluation. And the Stigma with Support Stream also came up with a recommendation that there needs to be advisory councils that were created in these populations that are overrepresented in the surveillance data. So for this presentation, I'm just going to really narrow in on recommendations and areas of focus that are specific to the LGBTQ community. So for PEP and PrEP, as we know from 2015 from the Sex Now survey, in Calgary, 43% of the respondents indicated that they had not previously been aware of PrEP. So since then, the Edmonton Men's Health Collective did do a survey that actually they designed specifically for the purposes of informing this actual strategy development that we did in Alberta. And they found that when they did their survey in 2016, 75% of the respondents did understand the purpose of it, and the Calgary Men's Wellness Initiative also indicated that 52% would actually like to use PrEP as a risk reduction strategy if it was made available. So we know that there's a lot of interest in Alberta, but there's actually still a lot of room to educate others and inform people on what's out there. And of course, it's still not currently publicly funded in Alberta, and so they wanted to form a working group. And so this working group was going to be one of the primary objectives in their first meeting is in fact next week. And then they also wanted to focus on creating care pathways for PEP and increasing equitable access across the province, and also starting up training for PrEP, and also having frontline community agencies more informed on PrEP. And so there's a lot of really exciting work actually happening in Alberta relating to this, and those members will be a part of that working group. Okay, another significant recommendation was people simply need access to information. And in Alberta, they created, the Alberta Health and Alberta Health Services created a sexgerms.com website, which I can say there's a lot of room for improvement on that based on the feedback that we heard. In fact, the Edmonton Men's Health Collective survey indicated that 76% of respondents had no idea it even existed. So there was a lot of interest, I think, and this was probably one of the significant recommendations that went right across all 5 different teams, even though they worked independently, was there needs to be a really good website. Now, of course, BC has several great websites, and they're looking for the same kind of thing, where you actually can figure out where you can go for screening, what the hours of operation are, what kind of screening is offered, is there screening offered to specific subpopulations that is really welcoming. They came up with a great idea about having a grab bag. So right now, if you go to the STI clinic, it's a 2 to 4 hour wait in Alberta. And so could you go in there and pick up a bag and go to your lab, and it'd be completely client-centered testing. Also, is there a way to notify people of the partners that you've had anonymously through a website so that you don't need to report those to a nurse? We already know that many people do not report the names of those that they had sex with, even if they have been told they've been infected with something. You know, having those text message reminders, all those things exist already in BC, which is really exciting, and we'd like to bring that to Alberta. Primary care, we've heard already today in this session some great evidence of the important role that primary care providers can have. Now, 11% of people in the Edmonton Men's Health Survey indicated that they would, only 11% would go to their family doctor, and most of them would prefer to go to an STI clinic. So they wanted to create some guidelines for primary care providers. There are no screening guidelines in Canada at the moment that are provincial, and so we would really like to focus on that so that primary care providers have an understanding of and develop that comfort and capacity for screening. But other than just leaving it as a responsibility for physicians, we also thought it would be really important to expand the nursing scope in Alberta so that nurses could have the option of doing a specialized training, and in fact some of the nurses that are within these primary care offices could actually lead that work in doing the screening. Another significant theme was that people were seeking out specialized care. As I mentioned, most people that responded to the Edmonton Men's Health Survey actually indicated that they would prefer to go to an STI clinic. And so the STI clinics are taking that and reflecting on how they can do their business differently so that the people don't have to wait as long. So they're streamlining their pathways, they're asking for more nursing staff. And there's also recognition throughout the strategy for developing care pathways that is actually inclusive of all those community-based organizations that have an impact on retaining people in care that are living with HIV or viral hepatitis. A lot of the recommendations that were very popular all revolve around client-centered care. No surprise, people want to be able to go and have control over when they can get screened and how they can get screened and not have to access a healthcare provider for that. Another focus is to really look outside of the traditional norms of healthcare and actually look to, pharmacists came up as a significant source that we want to really tap into. There's already prescribing authority for a lot of pharmacists in the province, so how can we increase their comfort and capacity to increase screening? And also, of course, expedited partner therapy. I believe it's already available in BC, but we don't have that in Alberta. So that just means that when somebody comes in to get tested, and if they test positive for chlamydia, we give you the medication for all your partners and you can pass it on to them. The final area of recommendations was around stigma. And so, they really wanted to focus in on reflecting on the public health nurses' roles and those HIV non-disclosure nurses and the guidelines that they're following. Are they really in alignment with U equals U? That is something that we're currently focusing on and want to improve. And also increasing access to care and advocacy for those within the LGBTQ community. So there's lots of stigma training resources that were highlighted by the Stigma team that were developed by the Canadian Public Health Association to really look at interview tools that people are using in their organizations. Are you asking the questions that are actually going to reveal if somebody's going to be a source of stigma? And also really looking at systemic interventions, such as through the licensing body in Alberta for registered nurses. There's over 20,000 registered nurses. So is there a learning plan that can be developed that could actually prompt nurses to reflect? And social media campaigns are underway as well. So this whole exercise of developing these recommendations in this team format aligned, I think, a lot of the organizations to not only appreciate the work that others are doing across the province, but to see the value of collaborating more purposefully, and there's real recommendations for maintaining those working group structures so that ongoing communication and collaboration can continue. And so as a result, we're moving into a collective impact model. Really, it's a reflection on the work that we've already done, but it's actually a formalized model that has 5 different conditions. And I'm not going to go into that in great detail, other than just to say that the developers of the first article relating to collective impact, John Kinakin, Mark Kramer, said, "We believe that there is no other way society will achieve large-scale progress against the urgent and complex problems of our time unless a collective impact approach becomes the accepted way of doing business." And this is something that actually Alberta Health Services is seriously looking at rolling out across the entire organization. This diagram really just highlights that there is actually a structure that we're going to be moving forward. We're moving into implementation. All of these working groups are being formed at the moment, and implementation formally starts in January 2018. There will be a steering committee and the advisory councils informing the entire process. There is a backbone, which means the organizations that are responsible for the infrastructure to maintain the work is Alberta Health Services and the Alberta Community Council on HIV. Our joint backbone moving forward, and hopefully this will filter down and allow for more opportunity and engagement from stakeholders so that we can actually have some significant impact on STBBIs in Alberta.
Great, thank you.
Yep.
Thank you, Cari.